Great. Well, I will go ahead and get started. Good morning, everyone. My name is Anna Kowalczyk. I am the Museum Administrator for the Livingston County Historical Society and Museum here in Geneseo, New York. It's nice to see friendly faces back. If this is your first time joining us, welcome. If this is your fourth time joining us, welcome as well. I wanted to tell a few little housekeepings, introductions, and then we'll get started. We are asking people to be muted just to keep the background noise at a minimum, but when we get to any questions halfway through or at the end, we'll ask you to unmute yourself so you can ask your question directly to David. I wanted to let you know that we have this series, virtual series, at the end of it. So next Saturday will be our last of the 5 series. And each of you will be receiving, a little survey. Something that I think is going to take about a minute, something brief that we'd love some feedback from you. And maybe this is something that we can continue to offer in the future as a silver lining of the pandemic. We learned to do something new. We also will be, concurrently, we're working on an exhibit on 1918 influenza and COVID-19, deadly diseases a century apart. So when we open, hopefully May 1st, we'll have that to share with the public as well. So those are things to look forward to. This week's topic is the third wave winter, 1918 to 1919. Kind of paralleling, I guess, this time in our pandemic in a sense, but David Pompous is here to share with us this 4th presentation. He earned a Bachelor of Science in American History and Political Science from Empire State College. He earned a Master's of Arts in American History from SUNY College at Brockport, where he wrote his master's thesis about the 1918 influenza in Livingston County. He earned a Master's of Arts in Social and Public Policy from Empire State College and is a doctoral student in education at Valdosta State University. And most importantly, he's a board member now at the Livingston County Historical Society. But we welcome David today. Take it away.
Okay, good morning and welcome back, everybody. I hope you're all staying warm. I know where I am, it's pretty cold right now, but I guess we've had a pretty easy winter, so I guess we can't complain. I think is somebody screen sharing?
Yeah, Kathy Deffenbach. You need to unscreen share. Kathy Deffenbach, can you unshare your screen, please? Here, I can do that. I did that, so, okay, got it.
There we go, thank you.
I learned a new button.
Yeah, it's interesting, Anna, what you said, comparing the third wave, which is actually taking place at the same time as we're currently living in with COVID now. And I think what's interesting when looking at the two is just how flipped they are. We're hearing right now that we're going into, or we're actually kind of in the middle of a dark winter, where, there's all these different strains of the virus, and, a lot of people are falling ill and dying due to COVID. Whereas for the 1918 flu epidemic, by the time you get to the third wave, it's kind of almost over. Not quite, but it's certainly much less severe than the third wave. In fact, there are some historians who actually, when they're analyzing the 1918 flu, they kind of lump the third wave into their discussion of the aftermath, because when you think of the 1918 flu epidemic, it's the second wave that's really the biggie. That's where most of the infections are. That's where most of the deaths are really piling up, is in that second wave. And again, by the time you get to that third wave, it's really sort of dying down at this point. So what I did was, we're going to take a look at, there are a couple different lenses we can use when talking about any historical event. You can look at it through a political lens. You can look at it through, you know, more of a statistic lens, especially with the 1918 flu epidemic. How many people are getting sick versus how many people are are surviving versus dying. I, for this one, chose a little bit different of a lens. So this presentation is going to look and feel quite different than the last couple. Here's why. When we went over the second wave, we really did a deep dive into rates of infection. We really drove home the debates that were happening, both throughout the population, in the medical community, and we talked a little bit about what was going on politically, especially when it comes to Woodrow Wilson, who didn't do much, versus leaders of St. Louis and Philadelphia, and how they look at the virus. By the time we get to the third wave, things are slowing down. And the American public, and not just the American public, but worldwide, are now having to grasp with how many people have been lost. While at the same time, people are still getting sick, even though the numbers are less. But we have regular people trying to understand and conceptualize and you know, try to figure out how to frame what had happened. So for this presentation, rather than sort of doing more of the same of what we did last week and the week before, we're going to look at this in a little bit different of a lens and talk about what were people doing, how were people making sense of what was happening. So of the presentations, this week and I think next week, last week ran over because of just the massive amount of material that we had to cover. This week probably won't go the full hour. Same with next week. I gave it an hour in case we have questions or room for discussion, but the presentation itself, these are going to be a little bit shorter because, again, really at this point, the pandemic is starting to slow. It's starting to come to an end. By the time you hit June of 1919, it's basically over. The pandemic phase of the 1919 or 1918 flu is over. But the virus doesn't just go away. It's not like June hits and it just vanishes. It does keep coming back in small pockets. And that's more of what we're going to talk about next week. But this week, again, we're going to go into the third wave. So I'll pull up the PowerPoint. And as usual, the first handful of slides will be a review. Just sort of what, for those of you who are just joining us, maybe who missed last week or came in a little late, we're just going to review a little bit of the second wave just to refresh that and then go into the third wave. But the third wave, we're going to look at it from more of a social and cultural perspective as opposed to a medical or political perspective. Okay, can everybody see my screen? Yes? Okay. So we're going to start off with just kind of looking at the second wave. Again, this is just a review, just for anybody who may have missed last week. So the second wave is really the wave that was attributed to the most deaths during the pandemic. When most people think of the pandemic, it's really the second wave that we're talking about, because it's really that second wave where things get really, really nasty. And people are really dealing with trying to stop this virus. At this time during the second wave, there was a medical shortage, especially specifically with nurses that were over during the war due to World War I. And as we've talked about the last couple weeks, scientists, they weren't quite sure what to make of the strain. They weren't quite sure what to make of what was happening. The second wave was probably a mutated version of the strain, which was now far, far deadlier than that first wave. And so between September and December, you're looking at about 292,000 American deaths, and that's probably a conservative number. Most likely, there were quite a few more than just this 292,000. And when I say just, that's still a really high number, with October being the deadliest month, 195,000. And again, these are conservative numbers. The death rates and infection rates are probably a lot higher. So we also talked about how the country is responding. And we looked at, generally speaking, two different models, St. Louis versus Philadelphia. And Philadelphia, again, really became the model as how to not handle a pandemic. Local media and political leaders downplay the virus. In September, there are some sailors that fall ill. The city ignores it. They hold a parade with about 200,000 in attendance. Within a month, 12,000 are dead, and they lead the nation in influenza deaths. In St. Louis, on the other hand, they see the epidemic coming, so they prepare. They shut down the city, including theaters, schools, churches, sporting events. Masks are worn, quarantines mandated, and they do fairly well. These sorts of debates really defined that second wave. Um, and most people, really did follow the health guidelines that were put in place. But again, there were these debates. So here's just the effects of social distancing on the 1918 influenza, which we talked about last week. You can see the difference between Philadelphia and St. Louis. So that's what we looked at last week. Um, so now we're going to look at how people are now dealing with this death on just a massive, massive scale. So Livingston County, they sort of counter the national narrative. We talked about how the national narrative really focuses on these sorts of debates and large death statistics, especially coming from urban areas, these large cities. The debates that are happening over health measures, over quarantining. A lot of the population felt that being told to wear a mask was somehow a infringement on their rights. So they pushed back. There were anti-mask groups, and sometimes things got violent. But if we look at Livingston County, it's a little bit different. The narrative is a lot different, actually. So in Livingston County, residents embraced the public health measures. They close churches and they promote spirituality from home. Spiritual leaders in Geneseo, Dansville, Nunde, Avon, and Mount Morris urge residents to comply. The local religious leaders state that obeying quarantine measures is actually doing God's work because you're saving lives. They urge the family to use the quarantines to actually strengthen the family unit, to really spend time together. So Livingston County is actually pretty successful in combating the flu when compared to other areas. Now, there are some other things that we have to take into account, such as population density, right? The population density in a big city is going to be much different than Livingston County, where people it's less populated and people are already naturally more spread out. That being said, following those public health guidelines really helped Livingston County. So if we look at the third wave is really the winter of 1919, and it goes to the spring of 1919. By the time we hit June, the pandemic is basically over. And when I say that, I mean the pandemic phase, because this keeps coming back, but certainly not in the same way that we had seen at the height of the pandemic. But it doesn't go away. In fact, we're still living with the 1918 influenza strain. We talked a couple weeks ago about how closely related the H1N1 strain of the flu is. Once the pandemic ends, the flu jumps and it mutates and it changes. So I guess just don't take away when I say that the pandemic is over, that the virus is over. that strain is still with us. But if we look here, this is kind of from the CDC, a general chart. And if you see in 1918 how high the spike is, by the time we get to 1919, it's really low. It's really low, especially compared to that second wave. So things are starting to get better. Now the third wave is much less severe than the second wave. It's not spreading as fast and it's not as deadly. But it's still worse than the first wave. The first wave was just that beginning. And that first wave, it happens in the winter of 1918 going into the spring of 1918. And by the time you hit the summer again, summer tends to burn influenza out because of the weather. And that's kind of what happens before it comes back really with a vengeance in September. So the third wave, it's right there in the middle. It's worse than the first, but nowhere near as severe as the second. The third wave is characterized mostly with isolated outbreaks in large areas. Though there are sporadic cases, it is going on throughout the country and still in Livingston County. People are still getting sick in Livingston County, but it's mostly characterized by large isolated outbreaks. And it lasts until June 1919. By the time we hit June 1919, it's pretty much over. And when you look at the scholarship, well, not just the scholarship, but the primary sources, the newspapers from the time, something really interesting happens. In winter of 1918 through spring of 1918, people are just starting to talk about it. When you get into the summer, the talk dissipates a little bit. From September through December of 1918, if you look at the newspapers, that's all people are talking about. It just dominates every aspect of the media. And it's sort of the same in the months of January and February. In March, it starts to taper off, and then something interesting happens. By the time we get to April of 1919, nobody's talking about this. It has gone away from the news. It hasn't gone away from the population. People are still dealing with it, but they're done talking about it. There's just this really incredible drop in newspaper articles and newspaper reportings about the flu. You almost get the sense that people are just weary of it. They're done talking about it. It's been such a drain on every aspect of normalcy in life that it goes away. And also remember too, Americans and a lot throughout the globe, but here we're just talking about the United States. People connect the 1918 influenza epidemic with the war, with World War I. So by doing that, when the war ends, it sort of makes it easier. Once the flu starts to go away, given that it's connected with World War I and how people are understanding this, they stop talking about it. It's done, it's over. So World War I ends actually in November of 1918, but the virus still rages. And one way people are really conceptualizing this is by using wartime dialogue and rhetoric in their understanding of the flu. It's a foreign invader. We're under attack. We need to defeat this enemy. So that's one way people are really looking at this. And we've talked about that a couple times throughout these presentations. So when I say that it's a lot less severe, I don't want to be misunderstood in that people weren't dying. Entire families were still afflicted. And this is an example out of Dansville and Mount Morris. So in the center picture there is Martha Root Hinman. She was the mother of the two gentlemen who she's in between. On the left is Frank and on the right is Walter. And then to the left of Frank here is his wife Catherine and their son George and their new baby Walter. This entire family was infected with the flu. So it really is still affecting people and entire families. We have a lot of instances, especially in New York City, where both parents die of the flu, and the children are orphaned. That is um, a problem that the country has to wrestle with and figure a solution to once this is over, especially is the amount of orphaned children. But here, this is in Dansville and Mount Morris. It's an entire family. Households are afflicted, and this is the obituary. So here we have on the left Martha, and then to the right her son Walter. They both die of influenza. They both die within days of each other. And this article is printed in the Picket Line Post, and it's really an interesting, sad but interesting obituary to read, because it gives a lot of background about the about both Martha and Walter. They're standing in the community, and it really shows how, again, people are dealing with this. In the second or third paragraph, it talks about how the Grim Reaper visited the same household. They lived in the same house together, um, and and they both passed away of flu within days. Again, same family, right around the same time. Frank's wife and son were both sick with influenza. He had just lost his mother and brother, and he wrote a letter stating, "I fear I may have nothing left in this world." He's writing a letter talking about the way he's dealing with it, and he actually packs everything up while his wife and son are sick. He decides that when they pass away, he's going to have nothing left, and he's going to have to leave town. Luckily, they both survive. Both his wife and son both survive. But as we said in the beginning, the flu kind of kept coming back. And a few years later, the baby here, Walter, who's named after Frank's brother who died in the flu. Walter also dies of the flu at just over a year old. He dies of pneumonic complications due to influenza. And this is after the pandemic. So it does keep coming back, and it does infect and afflict entire families. All right, so I thought this was kind of interesting, just to draw a connection between 1918 and now. This is a newspaper comic book, or comic, that was printed in a newspaper during the influenza, and you see a child sitting by the fireplace, and the mother or caretaker is saying, "Don't you think you'll be able to go to school by tomorrow, Martin?" How many of us could find that relatable? Um, People are dealing with a lot of the same things we're dealing with now. Schools closing, um, the children home all day, every day, um, public gathering places closing, debates over these public health measures, debates over wearing masks. It's sort of interesting to draw the parallels, because in some ways, a lot of how we're looking at this, things haven't necessarily changed. So from this point, when looking at the epidemic and trying to understand how people are dealing with this, we're going to go back in time a little bit further and draw a comparison with another deadly epidemic that happened, and use that as a means of comparison for how people are dealing with the pandemic in 1918. Before we do, does anybody have any questions? Are there any questions in the chat?
Yeah. There were a couple questions. The first one was about the comparison between Philadelphia and St. Louis. And Marshall Smith, if you would unmute yourself and ask it directly, please. Well, Marshall Smith, do you have a question you want to ask?
Oh, okay. Now
Yeah,
I'm.
go ahead.
It seems that the Philadelphia curve was a high spike and then dropped to zero very quickly over a shorter period of time than the St. Louis one. But anybody who knows curves knows that even if a curve lasts a long time, but is shallow, it could still have the same number of cases or deaths as one that spikes and is shorter in term. So I'm wondering how the total cases and deaths compared between St. Louis and Philadelphia.
Yep. I don't have the exact numbers, but as far as the total cases and deaths, St. Louis did much better. Much better. Yeah, St. Louis did much better than Philadelphia. I can actually I can get those numbers for you because they're pretty well published. But if you compare the two, St. Louis fares much better. By the time you get to the third wave, St. Louis is not entirely, but closer to being out of the woods than Philadelphia. So the numbers match. Philadelphia at one point and throughout a lot of the pandemic, they actually lead the nation in the amount of infected and deaths, whereas St. Louis, they're way down at the bottom. That's a really good question.
Eddie Lee, you had a question about schools and the pandemic. Do you want to unmute yourself and ask it yourself, please?
Hi, David. So there's a lot of discussion about schools today and the current pandemic. So I'm wondering, how did communities handle schools during the 1918-19 period? Mm-hmm. And second part of that is, there's little evidence about the Geneseo Normal School locally and the pandemic, but it appears that they remained open. What can you say about that?
Okay. Interestingly, just a few days ago, we had a meeting. It was Sue, Anna, and myself, and we talked about the state of education and what was going on, and that was something that I hadn't looked into, and I kind of raised the question of, I wonder what was the state of education like in 1918. And Sue, actually, I think she must have done some sort of research on the topic. So Sue, if you'd like to kind of jump in and answer that question, feel free, or I can just let them know what you told us all during our meeting.
What I found for Genesee County, they started closing the schools. Bergen got hit first, as closest to Monroe County. And gradually they closed all of the schools, which at the time, the bulk of them were one-room schools. They didn't have centralized schools yet. But what happened was, once they started to open up again in March of 1919, they didn't stop. So the kids had to go the whole summer. They didn't get a break in the summertime and went so there was a whole group of kids that they didn't get a break. They just kept right on going. The impact also was to the local farms, because a lot of the kids worked the farms. So during that summer, they're going to school, then they're coming home, and they still got to get the hay in. So they were really busy, but they had that downtime. And the one article I found, there was a doctor in Batavia who was going door to door, and he turned around and there was a group of little kids following him. It was like a Marx Brothers scene. They all were mimicking how he walked and just following him around town because they were bored. They had nothing to do. So, and some of the kids got jobs helping in downtimes. They would go and get paid to work on the farms because there was a shortage. But what I found really interesting is I never found any complaints from the teachers about their salaries or there was no school union, so they didn't have that element. But yeah, the kids were not that thrilled when they found out they had to go all the way.
They had to go through. So when they reopened the schools, they went summer school.
Right.
Yeah.
Straight. Yeah.
Yeah. Thank you. That's a really interesting. Like I said, I hadn't looked into that specific question, so that was a really interesting thing to know. And Eddie, as far as your other question about that the school in Geneseo, I do not know the answer to that. The only thing that I know is that the children's schools were really, and the churches were closed down. Um, as far as the second part of that, I don't know the answer to that, if that school stayed open.
I'll ask my question. And one thing, Eddie and David, I could ask the Liz Argentieri or at Milne Library. There may be some other information that we can try and sleuth out. And I know Liz is on this call too. I don't mean to put you on the spot, Liz, but something we could look into. One of the things that I'm remembering from doing some reading about the pandemic in the U.S., nationally, and I think you addressed this point, but maybe you could again, that there were people actually who died because they didn't have food, because nobody was afraid to bring it to go near them. And so this sort of the scare, somebody had just left some food on their porch, that they could have at least eaten during their illness. But I think you addressed this, that Livingston County, you just didn't see that kind of response. You saw more of a, neighbor did help neighbor kind of a thing.
Yep.
And I think that's an important, we who love Livingston County and where we live, if you could just maybe refresh us about that story,
Sure.
if you can.
Yeah. So within Livingston County, people really are helping each other out. We talked last week, there were a lot of examples of it. Again, Geneseo publishes in their newspaper, we looked at that newspaper article last week, where they say this is our duty to protect ourselves and our citizens. It's our duty. So that's just a different mindset than we see throughout a lot of the country, and that's in Geneseo. In Mount Morris, there are reports of they have so many dead that they can't bury it. So the surrounding towns in Livingston County help them out. They send doctors, they send undertakers, funerary professionals. Dansville was really big. We talked a lot about Dansville and how they set up makeshift hospitals, and these are just citizens helping. We talked about Nurse Betts and the good work she did in that hospital. So you really have this sort of community feeling where people are really helping each other out, and people really are supporting these public health measures because it's just the right thing to do. So there's a sense of community. Now, that doesn't mean that people, of course, were reckless in helping each other. As we've seen there, it was the opposite. They followed these health measures. And that is how they helped each other. That is how they were selfless. It wasn't, oh, this really affects my life. This is a negative impact on me and poor my children. We can't go to school. We can't do all the things that we usually do. This is the right thing to do for our community. We have a duty to do it. Let's help each other out by staying home, by wearing masks, by setting up these medical centers, by loaning out our professionals to other areas within the county. So I think that's really interesting, because that's a big narrative change from what the mainstream histories are. They really focus on these arguments and these debates within the populations, and it looks like, at least in the case of Livingston County, these rural areas, it's a lot different of a narrative that's coming through. Let's see, I'm seeing things in the chat. Okay. Are there any other questions before we move on?
Tracy Gagne was just saying that she's been walking through the cemeteries, and she can only find a few deaths around 1918. We'll try and include some of that in our exhibit. So like for instance, in St. Mary's Cemetery, we have a list of those who died in 1918. I don't know, that's something we could look at for Temple Hill Cemetery, but Tracy, did you want to add anything to that, or?
No, just that I've been more aware of that as I take my walk and I look and I see, a couple infants born and died in that year, but I'm just not seeing a lot of that year like I thought I would as I'm getting more aware.
And are you in Livingston County?
Yeah, I walked through the Geneseo Temple Hill Cemetery.
Okay, so a few things. So a couple things to keep in mind. Number one, the population in Livingston County, especially back then, is a lot lower. There's a lot less people. Also, they did what they were supposed to be doing. So you're going to, just because of that, you're going to grave markers for 1918. The population is denser. They're doing what they're supposed to be doing. But here's the other thing to keep in mind. We talked about Mount Morris in the second wave and how the dead, they couldn't bury the dead, right? A lot, and there's a picture of it here on the screen. A lot of them are in mass graves. A lot of people, when they were dying in mass like that, wind up in mass graves. It's the way they had to do it. So keep that in mind as well. So there's a few reasons for that.
I think we're ready to move on, David. Thank you.
Move on, sure. All right, so the second wave, the high death count is over. Well, not entirely. People are still getting it, but again, much less. So now that the pandemic is starting to come to an end, people are having to really sort of cope with what they've just gone through. The death and the disease and the suffering at such a large scale. So to do that, what we're going to do is go back in time a little bit to draw some comparisons, because the great thing about studying history is that when you look at the past, you start to notice patterns. That's really the point. Patterns start to emerge, and historians can start to make generalized predictions about how people will handle certain events, how certain events may play out within their given context. So that's really the point, is to look to the past to see what patterns emerge. And in this case, with the 1918 flu epidemic, we have the Black Death. In terms of recorded history, global pandemics, the Black Death is number one. 1918 flu is sort of ranked number 2 in severity, and then COVID, I think, is about number 3. But if we look at the Black Death, and I'm not going to spend a lot of time on this because this isn't a presentation on the Black Death, no matter how interesting it is. It's on the 1918 flu. But we can use this to see that people don't change a lot in how they understand things. People don't change a lot in how they deal with it. So just really quick, very, very brief overview. The Black Death was bad, very bad. So here's this little plaque here, this commemoration plaque. The Black Death entered in England in 1348. So it spreads through from 1347 to 1353. It kills about 50% of the population. Again, that's probably a conservative number. It's considered the most fatal pandemic in recorded history. It killed up to 25 million people, but some historians think that it's closer to 75 million, maybe even higher. So this is bad. This is bad. And people have to deal with this. Some of the symptoms here: rings appear on the skin at the initial outbreaks. You'll get rings that appear on the skin. You get extreme fever, bleeding from the mouth, nose, and leaking out of the skin. And the skin turns black. And because of the high amount of deaths, the smell of death was so awful that survivors would have to place flowers in the pockets of the dead to mask the smell. That's how many people were dying. And it was impossible to bury all the dead, so they had to do mass burnings of bodies. So how did people deal with this? Well, a lot of what we do is memorialized in kids' rhymes, in kid songs, and it gets passed down that way. So we have the example of Ring Around the Rosie. The red rings, flowers in the pockets that hide the scent of death, pockets full of posies, and the mass burnings of the bodies. Well, in 1918, we talked a little bit about last week. Again, we have it sort of memorialized in a kid's rhyme. I had a little bird and its name was Enza. I opened the window and influenza. So it's sort of interesting the way, now Ring Around the Rosie, of course, is still done. It's still passed down, but the 1918 influenza version here necessarily isn't. And we're going to talk about why next week. That's pretty intentional as far as public remembrance versus private remembrance. And that kind of dominates the aftermath of what we're looking at. So that's one way people sort of dealt with it. But another way is through art. Art is really powerful. It's a way of conceptualizing what's happening. And in most major pandemics, death or the disease is sort of anthropomorphized or personified. Death takes on sort of more of a human characteristic. In this case, in the Black Death, we have the art emerged before the Black Death, but it was really popularized during it. It was called Danse Macabre. And the idea here is, we can see it's sort of morbid. You have the skeleton, the idea of the disease or death. And on the left-hand side here, you have a priest with death grabbing him by the arm. And on the right-hand side, it looks like a peasant sort of farmer. Death, again, coming for him. So the idea here, it doesn't matter what your status is. It doesn't matter if you're wealthy. It doesn't matter if you're a man of the cloth. It doesn't matter if you're a peasant. You're not going to escape it. That was the idea. And this sort of artwork and the framing of death as a tangible, almost person-like idea really starts to come out post-Black Death. And that idea really carries into 1918. People in 1918 frame, conceptualize, and understand the death and suffering that's going on in the same way through personifying it. We have here in 1918, again, the Grim Reaper, or it looks like Jesus kind of holding that Grim Reaper's scythe. Death is the Grim Reaper. In Dansville, the newspapers consistently refer to the epidemic, the flu itself, as the angel of death. In that obituary, again, we have death personified. The Grim Reaper visited the same home. So it's the same idea, the personification of death as sort of a tangible idea that you can hold on to. Because if it becomes tangible and it becomes sort of personified, you can then take it on, you can understand it, you can maybe even defeat it, right? As opposed to this abstract, invisible sort of idea. So that's how people are really conceptualizing this. And you see it throughout the whole country. So it's very similar. People and the way we understand things and the way we mourn and grieve don't necessarily change. Another really iconic symbol. So in the Black Death and other pandemics, you have the Grim Reaper, Danse Macabre, the skeletons, the personification of death. In 1918, and you see this throughout the newspapers globally, well, she's personified as a lady, the Spanish lady. Typically with sort of a skeletal face, long black dress, holding a fan. And in this picture, it's kind of interesting because here's the Spanish lady right next to an angel. There are a few ways to interpret this as far as what the way the flu is looked at in the media and how people are understanding this. So one implication here is that the Spanish lady takes on the form of, for lack of a better term, a lady of the night, freely infecting anybody she wants. That's one way of interpreting that. And that was one personification. Another way, because there's always more than one way that people are understanding something. The other way, second, I'm having technical difficulties here at the moment. Okay, there we go. So really, her origins are in Greek mythology as an avenging goddess. In Christian iconography, she's the shadow of Madonna, the exterminating angel, punishing the world for our destructive war, particularly World War I. And you see a lot of that, especially when it comes to clergy writing in to newspapers. That's how they're understanding this. We're being punished. This war was horrible. It was devastating. Chemicals were used. So we're being punished for this. So that's how people are understanding this through sort of the personification of death. And I think to close this out is a great quote about the Spanish lady from Catherine Arnold in her book, Pandemic 1918. If you ever get the chance to read it, you should. It's really, really good, and it's really informative. It's a great narrative of a secondary source narrative mixed in with some really good interviews. And I think this defines it well. She's the lady of our sorrows, the Spanish lady, our torment. As a cultural phenomenon, she is impossible to resist, and this is her history. So really how people are looking at this are in a few different ways. Are we being punished? The sort of religious aspect of us being punished for these horrible wars, but they're drawing off of some mythology and iconography and the idea that dates back to the Black Death as far as the personification of death. So that's how people are understanding it in this third wave. Those are the sorts of things you'll see. If you go to the archives and you look at the newspapers, you're going to start to see people lamenting, why did this happen? How did this happen? What does this mean? That really dominates the third wave, because at that point, the death count is going down and the rate of infection is going down. So it's almost like that post-traumatic stress, right? It's over, or it's kind of over, or it's getting to the end. Now people are left with the shock of dealing with it. And that's sort of where we end for today, because next week we're going to talk about the aftermath. How are people recovering from this? And also using that as a way to sort of take a look at maybe what we have to look forward to, because there are some reasons to be optimistic. And when you look at 1918, and you compare it to today. So I thought this wasn't going to go as long. We have about 10 minutes, so it kind of went maybe even a little longer than I thought it would. Does anybody have any questions?
I'm just wondering, from Marshall Smith again, did you search through cemetery records, David, when you were doing your research?
Mm-hmm. Yes, I looked through cemetery records. I went through local newspapers, obituaries, medical journals. I kind of ran the gamut on that.
Marshall, was there something more you wanted to add about that?
No, I was just following up on your suggestion in the chat about the coming exhibit. And I thought maybe, I think it would be possible, because most of the cemetery lists in Livingston County are online anyway, or exist in digital form, that it would be pretty easy to set up a search and narrow it to only people who died in 1918 to 1919 for anybody who would be interested in pursuing that question.
Mm-hmm. Another interesting, it's a little bit clunky, but it's called Fulton News. I don't know if you've looked at it. It's a collection of online newspapers. It's really clunky, but that can be helpful too.
Mm-hmm.
Are there any other questions, comments, anything at all?
How about Michael Zaylor? Why don't you unmute yourself and ask your question directly, please?
So after the end of the 1918 pandemic, we had the Roaring '20s. Is that usually a following trend where there is a pandemic or some major event and then there's an economic boom coming along?
Yeah, that's actually a really interesting and good question. I'm going to talk about that in more detail next week. But to answer your question, well, there kind of is. If we look at the Black Death, following the Black Death, we had the Renaissance and the Enlightenment. Following 1918, we had the Roaring '20s, but the market does crash in '29, and there are some other things going on in the '20s. The world's pretty much bombed out, so except us, our economy does really well. But yeah, people can go out again. There is sort of a pattern of, after a major pandemic, society sort of getting to remake itself. And we're going to talk about that a little bit more in detail next week. But Mike, yeah, you're on target there.
And then Cynthia Hawk, why don't you go ahead and ask your question? I don't know if we'll be able to answer it today, but go ahead and pose it, please. Unmute yourself.
I was wondering about, the mention was made of Craig Colony, but I wondered about the Livingston County Alms House or the Poor House there in Geneseo. Was that institution still populated? Was it still functioning? And what were the statistics for that particular campus if there were residents living there? Is there any data?
That I don't know, which is interesting because looking back at some of the records from my own family history, I do have going back into the 19th century relatives who lived in the Alms House. I don't know when it closed. I really don't. That's not something that that I really looked into. But I'm sure we could definitely get the answer to that question for next week. I can see what I can find out.
Yeah, and I'll also follow up with our Livingston County historian, Amy Alden. I remember asking her the question, I was curious about orphans and would they have gone to the Poor House, but the answer was no. They would have gone someplace else, and I think more Rochester based. So that led me to believe that the Poor House was still in existence, but I don't know the answer to that. So we'll follow up. David, you could do your work, and we'll follow up with the county historian for next week.
Could I ask or make a comment, please?
Sure.
Thinking about the fact that next week you're going to talk more about the aftermath and personal history rather than public history, I was wondering, if individuals that are gathering here today might have their stories and their photos that they could share. I think it would be really interesting hearing from others in Livingston County and around the surrounding communities, how their family dealt with it. How was it memorialized?
Mm-hmm.
Anyway, I'm done.
No, I think that's a really good idea. And next week for the last portion of the presentation, I was going to throw that out and see if anybody who's with us would like to share what they've learned from their family members, because it kind of affected everybody.
And as a follow-up on that, there are present day COVID stories, right? That we all could share. Just to let you know, maybe I could put the link up there next week, the Livingston County historian, her office is currently collecting those stories present day. She's asking people to just type it in or send a video or things like that. So she's collecting kind of that data for this discussion 100 years from now. The Livingston County Museum is also collecting artifacts or pertinent information to COVID-19. For instance, the homemade mask made by a Livingston County resident, or for instance, the church bulletin that explained the closing of the church and so forth. So if people have those kinds of pieces of information they'd like to consider for the museum, that's another piece of the story moving forward. Love it. Last week, Marshall asked, or I think somebody asked about Caledonia. This week, we have somebody asking, what do you know, what are there any incidents, anything of information that comes to mind when you think of Lima, New York, and specifically?
Yep. So areas surrounding, first of all, Livingston County, wherever you happen to be, I looked through as many newspapers and articles as I could get my hands on. And I'll say this, they all generally follow that same narrative. Even areas that are small town outside of Livingston County follow that same narrative of following health measures, obeying quarantines, wearing masks. They all tend to follow that narrative. Once you start creeping more into the urban areas, that's where that's where you start seeing a lot of these public health debates. So Lima, I would bet the same for Caledonia. Even again, outside Livingston County, Bergen, Brockport, Hawley, Hamlin, they all generally speaking follow that same narrative.
And to follow up for the upcoming exhibit, anything we find, I know we have an article that references Lima at the moment. We're going to put anything we find together kind of in a binder. So if people want to really go look more deeply in any information that's been uncovered, that information will be available to the public once we open the exhibit.
I'd like to ask a question about, I know that your research is focused on Livingston County specifically, but I'm wondering whether in terms of the waves of the pandemic, was this parallel, do you know, globally? So what's the international context, do you know?
Yeah, to a certain degree, I know. So it's generally the same. In other words, throughout the globe at the very first wave, the illnesses are contained within military compounds. They're being transmitted between soldiers fighting in the war. That's sort of commonly shared globally. Also globally, that second wave, that's when we say that's where the majority of deaths happen, I know I sort of focus in on and target the statistics from the American perspective, but it is shared throughout the globe. It's that second wave that's really, really deadly. Although I think there might be a little bit of an exception in the case of Spain. They seem to be suffering a little bit more in the first wave than a lot of other areas, but generally speaking, it's the waves effect globally is sort of the same.
Thank you.
Sure.
Cynthia, why don't you go ahead and ask your question again, and then I think maybe Sue Conklin, you might have some information to follow up with her. Go ahead and unmute yourself, Cynthia.
I'm thinking of, because I've done a lot of research with the former Jackson Sanatorium Castle on the Hill in Dansville. That was an enormous residential property. And the Jackson family saw the handwriting on the wall that people were no longer vacationing at places like that. And the Jacksons very quickly closed the sanatorium and sold it to the US government. And it became a center for World War I soldiers who were coming back. And I don't know if they had PTSD, but it was something like that. With the multiple residential buildings on that campus and the number of soldiers and people residing there when 1918 pandemic hit, is there any information about flu outbreak up at the former Jackson Sanatorium campus?
Anna, you said Sue. Does Sue know something about this particular campus?
I think Amy has information on the Dansville, that because of the train bringing the soldiers, Dansville was hit high. But as far as the county home, what I found for Genesee County, and I went through the proceedings the other day with Amy, the county home is a nursing facility for elderly, and they were sort of cloistered as such. And the flu wasn't hitting that age group, so there wasn't any increase. I didn't see any increase in death. The only thing I saw in the proceedings, the people that were in charge of child welfare, they had an increase, having to deal and go to homes and check on children. So, and they made a comment in the proceedings, which is one sentence, and that was it. But as far as Dansville, I believe Amy said there's quite a few newspaper articles about it. And I know there was an article, I don't know if it was out of the Buffalo or Rochester paper, that listed Dunkirk and Jamestown and Dansville. Like they were specifically spotting high pop-ups in the second wave, and Dansville was that, and that was because of using the facility there.
Yeah, it's even in the report out of the Dansville newspaper, they say that per capita they think they got hit the hardest out of
Right.
Livingston County. And so you also made another interesting point. You talked about, you know, the railways, right, and how that was a high transmitter. And in Mount Morris as well, there was at a point where they couldn't bury all the dead, and you have Lackawanna Railroad going right through there, right? So there's another correlation.
And one final question is about the Spanish lady. Referring to the Spanish lady, she seemed to have an animal foot. Is that true? Was that her shoes?
I'm not sure. Typically with her, they look at the sort of skeletal face and the way she's dressed. Probably in this particular picture, looking at it, she appears to. As far as if that was sort of a universal commonality, I don't think so, because I haven't. It may be, but if so, historians and art historians haven't really looked at it.
Can I make a comment?
Go ahead, Charlotte.
I've thought about that foot also, and I thought about Carl Sanders' poem about the fog in Chicago. Comes in on little cat feet.
Yeah.
You know, and I thought she's sneaking in. You don't notice she's there until she's there. That might be.
That very well could be. And that actually goes along with the with actually any other interpretation, whether it be the sort of exterminating angel shadow of Madonna creeping in, or the Lady of the Night infecting everybody quietly, you know.
Yeah.
So I think this, unless people have a few more questions, moving forward for next week, that'll be our final series on the aftermath and continuing relevance. I made a few notes to myself that Liz Argentieri was going to take a little look at the normal school if she found anything between now and next Saturday. We were reminded to think about if we have family stories that we might want to share. So you have a week to maybe, if that's something relevant for your family. And we'll do a little follow-up maybe on the Jackson Sanatorium in World War I. It would make sense based on what Cynthia Hawk was suggesting that might influence the Dansville numbers. But we'll try and follow up on those pieces. People have really good questions and really good thoughts. So with that, same Saturday at 11. Feel free to share the link. And I thank you in advance for thinking about the survey that we'll put out post next Saturday.